us focus on India numbers now. And India saw a single-day rise of 25,166 COVID cases. That's the lowest in 154 days, taking the tally to 3.22 crore infections. And if we take a look at the number with 88.13 lakh doses of vaccines given in the last 24 hours, India also saw a new single-day vaccination record. There were 437 deaths as well in that 24-hour period. So let's take a look now at India's vaccination numbers. India has so far vaccinated 8.9% of the population, though as I said earlier, absolute numbers are so much higher, 55.5 crore. If we look at the best performing states, well, Kerala has vaccinated 19.9%, Delhi 16.4%, Gujarat 15.3%, Uttarakhand 15.3% as well, and Jammu and Kashmir 12.3% of the population. Well, to talk more about the Indian situation, we're joined by Dr. Lancelot Pinto, a consultant pulmonologist and epidemiologist. Thank you so much, Doctor, for joining us. And, you know, the situation that we're seeing currently in the US is so worrying, and we've also been through our own devastating second wave. But the way the numbers are right now, the way the vaccine coverage is right now, what is your view of what's going to happen ahead? Because there's been so much talk of this possible third wave.
Hi, Gargi. Thank you for having me on the show. I think it's very reassuring that our numbers are low right now, but going by the experiences all over the world, I think complacency is something that we should definitely avoid. This is a great opportunity, a great window that we have to vaccinate as many people as possible as soon as possible. You know, there were concerns at the last time when we were vaccinating that vaccination spots were becoming areas of super spread. And since the background rate of infection right now in the community is so low, this is a great opportunity to vaccinate as rapidly as possible. There almost certainly will be more waves in the future, but whether these waves overwhelm our healthcare system, lead to a lot of hospitalizations, lead to a lot of people dying, will depend upon how good we are at our vaccination strategy.
And it's important that we get more vaccines in our kit. You know, we've been talking about this vaccine, that vaccine coming, and it's important we get more because, you know, the way the world is talking, they're talking about booster doses and, you know, those who are more vulnerable requiring another dose of the vaccine to boost their, you know, protection. So given that, we need to get more vaccines in our kitty.
Absolutely. I mean, our target has to be to get people fully vaccinated as soon as possible. And if we still look at the numbers, it's still a minuscule fraction of the entire country which is fully vaccinated at the moment. There is data that's coming in that immunocompromised individuals, immunosuppressed individuals might need a third dose to mount an effective immune response. And, you know, while we are still struggling with 2 doses, you know, there are countries across the world who are already talking about boosters. So we really need to catch up as soon as possible if we want to win this race.
Right, and the government has spoken that they want to, you know, vaccinate as many people by the end of the year. Now, this whole issue of herd immunity is also changing. Now they're saying you need 90% people vaccinated to actually, you know, achieve herd immunity, especially in the face of the variants.
So if you talk about, you know, the R0, the number of individuals that get infected from a virus when the population is naive, the initial alpha variant, the R0 was speculated to be about 3, which meant that, you know, every person who got infected would infect 3 others. So the hypothesis was as long as you got 2 out of those 3 vaccinated, you know, you would keep the transmission rate below 1, which is where you want it. Now with the Delta variant, it's hypothesized that the R0 is somewhere in the range of 7 to 8, which means that every infected individual will infect 7 or 8 other individuals. And if you want to keep the transmission number below 1, you need about 6 of those 7 or 7 of those 8 vaccinated, which is pushing up the numbers to about 90% or so. So I think herd immunity is a very optimistic target, and that shouldn't be our target right now. Our target, rather than reduce transmission, should be to ensure that through vaccination, the individuals who do get infected have a milder course and therefore don't overwhelm the healthcare system. So this is like diseases like influenza. We've accepted it for other infective diseases that transmission will occur. Right. Our target needs to shift at keeping people out of hospitals as much as possible.
And any estimate now about this possible third wave, which everybody says will not be as devastating as the one that we just saw, but there were predictions that would, you know, we'll see cases rising by the end of August. It might peak in October.
So hopefully the third wave will not be a mega wave across the country, and, you know, we might have small clusters, which are easier to manage relatively, if we focus all our energies, and I think we're already doing that. We are looking at total test positivity rates and guiding our strategy based on those kinds of metrics, rather than have a uniform metric for the entire country. So a city like Mumbai, for example, which has a reasonably high level of vaccination coverage, with a lot of individuals already having antibodies by virtue of past infection, may hopefully suffer a milder third wave than maybe some other spots where background infection rates and vaccination rates are a lot lower. So I think we need to redirect our strategy towards preventing micro clusters rather than thinking of a big third wave, hopefully.
All right. Well, thank you so much, Dr. Pinto, for speaking to us on the program.